Picking up on this topic of hormones, because I know a lot of people listening to us here want to know about hormones. Women want hormones, men want hormones, everyone wants hormones. It seems like hormones are the solution to everything. They're going to solve all your problems. You'll look better, your hair will look better.
You'll date a lot.
You'll lose fat, your libido will go way up. And we know it's not really like that. Of course, there is an effect, but we also have to be careful not to have a side effect that could actually make things worse down the line. And considering that your goddesses, right, are around 35, 45, already close to menopause, which varies a lot, right? It ranges from 45 to 55, it depends. There are women who experience it even earlier. Thinking about that, with that in mind, before you intervene, because that's how I see it as a man, okay? I have a better understanding of male hormones because it's actually much simpler, right? Because women have ovulatory fluctuations, right? So doing hormonal modulation in women is much more complicated. It's simpler for men. We have testosterone that drops, but it drops in a more regular way. If it's low, you can check the DHT. If it's not decreasing, it's causing issues. The hormonal cycle for men is easier.
You don't have a uterus, you don't bleed, you don't have breasts, and you can't go through it again.
Perfect. Our main symptoms of low testosterone are basically 2 or 3. Hair loss, because it's dropping too much, right? There's too much DHT, so you get hair loss. Impotence, right? Which can be due to a deficiency of testosterone or even DHT. And weight gain. Yes. That's not really associated with hormones. Yes. Yes, age really can be a factor. So the hormonal issue for men is more, I'll put this in quotes here, simpler, okay? It's not really simple, but it's simpler. For women, it's more complicated. So thinking about men, I always say that modulação hormonal masculina, the longer you wait to start using the hormone, the better. Because you don't cause receptor resistance, and when you really need that hormone, you'll have a health benefit. I'm not talking about aesthetics here. I'm not talking to bodybuilders. I'm not talking to people who want to gain muscle mass. No. I'm not talking to fitness competitors. No. I'm talking about health. And for women, so let's say you have a woman, let's call her premenopausal. How can you approach it before it starts? You notice that it's not time yet to use hormones. What can you do to stimulate hormone production? What can be done there for about 5 or 10 years exactly to try to delay it, like you mentioned, right? To delay menopause, because that's a health issue.
Absolutely. First, you have to understand the complaint, right? For example, in my office, I always have women saying, "Oh, doctor, I don't have sexual desire anymore. I don't have sexual desire anymore. Sometimes I even do it just because I have to keep my marriage, but I don't have orgasms." And then they already come with the preconception that the problem with low sexual desire is because their testosterone is low. In fact, if we measure women's testosterone today, it will be at a lower level.
Not just women, the human race.
Everyone.
We're seeing alarming studies about men's testosterone levels. And then I saw more research related to men. With women, as you're telling me, it's actually curious too. Yes. And this is even a generation that isn't dating anymore.
No, there isn't. You don't have testosterone, but
since they already come in thinking it's only testosterone, explain it to the teacher.
We even have a beautiful scientific study which was done with a very large sample size, and it evaluates the main causes of low libido in men and women. Testosterone is in 8th place, so what's in 1st place, the main cause of low libido? Stress. Who isn't stressed these days? Cell phone.
No, and cortisol, even testosterone being in 8th place, there's nothing testosterone likes less than high cortisol levels. Yes, high cortisol, low testosterone. High insulin too, low testosterone.
2nd place, obesity.
Insulin resistance?
Insulin resistance. Stress, sedentary lifestyle. So answering your question, the first thing I say to my patient is, do you want to have sex? Do you want to have good sex? Are you exercising? No, I'm not. So the first point is A.
Dopamine also goes way down, right?
Oh, and another thing, this here, dopamine all the time, right? Yeah, people are addicted. Yeah. So testosterone will also drop. So these are simple measures that we can take which have a big effect. And another thing that I really emphasize, I always tell my patients, physical activity for women means weight training.
Yes, weights.
Weights. You have to work out, work your quadriceps, do squats. Make those quadriceps grow. We joke, right, in a group I'm part of, which is Hormones Mentoring, that it's like building a muscle bank. We have to build up a reserve of muscle because muscle loss is going to happen.
Sarcopenia, they're already saying it's as serious as obesity and insulin resistance.
So we need to invest in this, right? Oh, I don't have time.
No, but you have to make time.
You have to make time, but do you work from Sunday to Sunday, 24 hours a day? No. Do you have a weekend? Do it on the weekend. That's not true.
You have time to watch Netflix. You have time to watch silly stuff on TikTok. Everyone has a little bit of time, you know? Yeah.
Yes, you do. So I always suggest starting with lifestyle changes, because it works. Just by getting out of a sedentary lifestyle, starting to exercise and building muscle mass, a woman automatically boosts her testosterone production. Free testosterone.
Dopa, right?
And dopamine?
Because the thing is, especially when it comes to orgasm, it has a lot to do with dopamine.
Yes. And not only that, it also improves circulation. If I improve circulation, more blood reaches the clitoris. If more blood reaches the clitoris, my orgasm is better. Yes. So there are several.
More energy, more release.
The benefits, right? Supplementation, for example, B complex. Vitamin B12 greatly improves testosterone production. So we have some strategies that we can use, and we don't necessarily have to go straight to testosterone replacement.
Perfect.
Uh,
Just reminding you that we're talking about hormones for health, okay? Because someone might come here and say, oh, but my doctor prescribed me, I don't know, 300 of testosterone. No, not to raise it to 300 in the case of women. Or 500, I don't know. 600. Yeah, that's how much they use. No, for bodybuilders, right?
To gain mass, the doses are high.
There are people who use huge doses. We're not talking about that, okay? We're talking about women who will get an Adam's apple, who will speak with a deep voice,
Whose hair will fall out.
whose clitoris will grow. And later on, there will be libido problems. Yes, because there will be hormonal axis suppression. There will be a series of problems. We're not talking about that. We're talking about hormonal modulation, exactly, for health purposes.
And I'd like to take this opportunity to make a point, even as a warning, if you allow me.
Absolutely. Everything is allowed here, folks.
Yeah, it's actually a very interesting case I had at my office. A patient who had been seeing me for a while came in for a regular checkup, and I noticed that her upper limbs were stronger.
That they look more masculine.
Yeah, it really seemed like she was doing testosterone replacement therapy, but it wasn't prescribed by me. So I asked her, hey, are you using testosterone? Or are you using some kind of anabolic steroid? No, doctor, I'm not using anything. All right. At the follow-up appointment, she comes back and says, Doctor, I wanted, if you could, to take a look at a photo of my little girl's private area. Because a small lump grew there, I took her to the pediatrician, but the pediatrician didn't really know what it was about and so on. I saw the photo. Moral of the story. The husband, the man, was applying testosterone to his skin, and it was a very high dose of testosterone replacement.
A man has 10 times more.
And on the skin only absorbs 20% of that. So let's say if he was applying 100 mg, he was only absorbing 20. 80 remained on the skin, that's right. He contaminated his wife because she would sleep on his arm, and the girl too. So this is a warning that after it happened, right, since she didn't know, nobody knew about this risk of cross-contamination, I realized how much we need to, warn men who are doing hormone replacement too.
The opposite also happens, right? Your wife goes through menopause and so on. You can be contaminated with progesterone and estrogen, which your wife also applies to her skin.
Applying it, yes.
Yes, and estrogen is the same thing. It's a much higher dose for women than for men.
And I always warn, there is a more vulnerable group, which are children, the elderly, and pets. But everyone is subject to contamination, right? When we talk about transdermal therapy, it's very important to be careful about that.